Governor Gorobe, Minister and Health Secretary. It is really our great pleasure to be witnessing this moment. But I want to secure our appointment for a date in 2025. In 2025, may this groundbreaking be realized in a new modern hospital for our people in Central Province and Papua New Guinea. With this, we are putting our feet into the shower to ensure the ground is broken. Thank you.
All right, thank you very much. Well done, Central Province. You will see me as a regular visitor in the next 3 years, coming back and forth in this site. And this will not just be a hospital site for businesses, hotels, and others who want to be a resident of the new Central City going forward. The governor will be launching what will be our Central Province City Plan, and we welcome not settlers, but we welcome proper businesses to Central Province to give life and support around what will be our Central Provincial City. Imagine out of this site, coinciding with the special economic zone from Roto all the way back to Brown River, that we want as twin cities operating with Port Moresby and National Capital District. Thank you very much.
Which is a very timely moment, especially at the back of us going to Parliament tomorrow to pass our 2022 budget, budget that has greater focus on the health sector in our country, receiving over 2.6 billion kina of the 22 billion budget. Health sector receives the biggest. In fact, 11.2% of total allocation of 2022 budget is gone to the health sector, and Health Secretary and Planning Department will confirm this is possibly the first year in the last 46 years we've been a nation for health sector to receive the biggest allocation ahead of education and ahead of many other sectors in our country. And this is something that I want to make a case in point, that we are serious about our people's health issue. Health comes first, for we cannot compromise life and livelihood of our people. And so we've allocated this percentage of allocation to the health sector, and Central Province features very prominently in our allocation for the health sector this year, next year, and going forward. And for this moment, as we stand to put shovel into the ground to launch out Central Province's brand new hospital that should house over 300 beds in as far as the hospital is concerned. This story will continue, this journey will continue, this work will continue until hopefully in 2025 we're able to come and stand again here on this ground and a brand new modern 300-bed hospital is delivered not just for Central Province but for the country as an asset in which we can be totally proud of. We want to secure our people's livelihood and health. As the Health Minister alluded to earlier today in this conversation, COVID-19, if there was any one good thing about COVID-19, amidst many losses and many struggles we're going through as a result of COVID-19, one good thing COVID-19 has made, or made it happen in our country, is to inform us that our health sector and health system in our country is totally deficient to withstand whether it's pandemic or an endemic outbreak or any outbreak for that matter in as far as health issues and health need is concerned. COVID-19 has pointed to us this fact that we do not have the health system and the health capacity to handle severe outbreaks or any diseases for that matter in our country. I'll just give you one statistics. I note our media is in the house, and I say thank you very much for all the media who continue to transmit good messaging, correct messaging to our citizens and our country so that we all can be better informed and well informed. When COVID-19 was first realized as a global pandemic, and with every possibility of hitting Papua New Guinea as late as 2019 and as early as 2020 January, myself and the health minister and the health department, I called them all around and we sat and we looked at what could happen in our country's health system. Because it was indicated that COVID-19 virus, for instance, is no ordinary virus. Of every infection or transmission, 5% from that variant we had before in 2019 and 20, and not talking about the new variants and new strands of virus that is evolving, which is much more potent and much more dangerous. What we were told as early as 2020 and right through was that 5% of every, or 5% of the sample of population that gets affected by COVID-19 will become an ICU patient, intensive care unit patient, meaning they would need oxygen, they would need intensive care from doctors. I asked a very important question: how many ICU beds we have in our country? And we were informed that we had only 200 ICU beds in our country. 200 ICU beds. And because COVID-19, there is no medicine for cure. You either prevent yourself through lubricant, wearing masks, don't get in close contact to get COVID-19, or you inoculate yourself with vaccine to assist your natural immunity to act as buffer for you not to get COVID-19, or if you get COVID, for this not to be pushing you to ICU. There was no medicine, so I asked, how do you treat COVID-19? Well, you just need oxygen and reliable oxygen supply so that they are stabilized. Of the 200 beds we had in our country, only 44, Governor Parker, 44 had oxygen attached to the beds. Oxygen, the ventilation system or the tubal system that is attached for you to be put those oxygen facilities to stabilize the patient. Only 44 in our country, 44 beds had oxygen ventilations. That showed one thing, that our country is totally deficient of intensive care unit facility or general hospital facility to address pandemic or endemic outbreaks or any disease for that matter. And so in 2021, we made a conscious choice that investment in the health system will be ramped up. And something that our generation of leaders can give to our country at 2025, when our nation celebrates 50 years of independence, is a better reformed healthcare system in our country. And we're not just talking, we've now put the investment space by the evidence that over 11.2% of our total allocation for budget 2022 goes to health sector, and that trend will be ramped up as we go into 2023, 2024, 2025, and hopefully 22 world-class hospitals in our country is delivered. If not delivered, then it's taking shape, and amongst them, I want Central Provincial Hospital to have been delivered by 2025 as we live through the next few years of construction. And so today I'm happy to come and stand here as a gesture from national government, as a gesture from those of us who live in NCD, to ensure that your rights as Central Province is given to you for your forfeiture of what was supposed to be General Hospital to serve the country. I know that many parts of our country has a need for provincial hospital, and as I said earlier, we have a program for 21 provincial hospitals and our special region in Bougainville. And for Bougainville, there's a 70 million kina from our national government commitment packed aside to start the process of their own hospital. But for Central and 5 other provinces, they will be front runners going forward for this year and next year as far as delivery to a better, new, modern hospital. And Central Province, we're doing the groundbreaking today, and we should support this year, support next year, and for the next 3 years. And this time in 2025, when we stand on the podium, that is a new hospital we could walk into and open a new hospital. And I bring to you our fullest government commitment. We stand in the face of election, but doesn't matter elections. Government approved programs, and the programs run into and cross over into terms of parliament. And this program will run this year, next year, 2023, 2024, and as I said, in 2025, this is complete, we come and turn the key and give a brand new 300-bed hospital that has modern facilities to the people of Central. And I, as Governor of Central has said, they should not just have Central, but of course benefit the city and benefit all of us who live and travel in and out of the city and in and out of Central Province and to the 500,000 people of Central Province. Central Province and city combined has 1.5 million people at any day moving in and out and living and coexisting. 1.5 million people. Port Moresby General Hospital is now elevated to a national referral hospital, and it is in our strategy. We will take off Central Hospital and we will take off one more hospital in the city, and Gero has become the obvious choice. Gero will be another hospital that we will visit so that they coexist. The city hospital taking care of the city, the Port Moresby General Hospital will become a national referral hospital, and in case many of you do not know, our government has put investment for heart facility and cancer facility. For next year alone, there's a 62 million kina program for specialist care in Port Moresby, so you don't need to go to Singapore or Philippines or Australia for heart care and all these sort of things. We're not just talking, we're putting money, and this program is running. Next year we have the 62 million kina for the specialist care in the Port Moresby Hospital. And Port Moresby Hospital will not just be for a city, it will be a national referral hospital. And so, speaking with the presence of Governor Pakop here, there will be another moment in which we mount a hospital for the city. And as I said, Gero has become the choice in as far as the site is concerned. But for Central, this moment has arrived. It will be a 500 million to 700 million kina program in as far as this hospital is concerned. Just like our government is now slowly retiring a 500 million kina program in Enga province. The previous government gave contract and procured through a partnership with Chinese Exim. But PNG government's counterpart funding, we put money down in 2019, 2020 and 2021, and for 22, last 57 million kina is put in so that we take off Enga Hospital once and for all, and is retired and it's operating and can serve as a specialist hospital for those who live in the Upper Highlands. From this, we will be moving on to Hela, Southern Highlands, Gulf, Western, Kimbe, Manus, Bougainville, for those that need hospital the earliest. And today I am pleased to come to announce that we are launching this hospital. It's a 500 to 700 million kina hospital, 300 bed hospital. We have a partner lined up to start to invest in this hospital to make it work. And in 5 years, 3 years time, I beg your pardon, in 2025, when we celebrate 50 years of independence, Central Province, your health would have been secured in a better modern hospital that we are launching today. Thank you for your support to the city. Central, thank you for your support to the city. Thank you for your support to your country. For you, you truly deserve a city on your own and a facilities on your own. And this Central Hospital is mounted on what will become a Central Provincial City concept that is coexisting with NCD from now and going forward into the future. And I'd like to thank your governor in conclusion for his strong leadership. Governor fights with us in central government, in the national government as well as NCD all the time for central provincial rights. And in fact, his fight is not something that we take for lightly and for granted, because originally this was one people, one place. The Hiri people, the Motukoita people, the Koyari people. You live in this part of the country for centuries, and we are here living with you. And he continues to fight for a right that has been preserved over many times, and we are here to honor him. Today is one occasion in which we are honoring Central Province through this hospital. I am happy, Governor, to partner with you. I look forward to stand with you in 2025 as we come back to open what we are mounting today, a brand new 300-bed hospital that should have every facilities any modern hospital can give. Who says it's wrong to give hospital to our people? It is their right, and we are starting this process. I thank you, Governor. I thank you, Central Province. We look forward to the maturity of this hospital we are mounting today. God bless each and every one.